I want to thank everyone for spending their lunch or their break, or if you're lucky enough to do this during your work hours, um, with us, specifically the Lunch and Learn. Today, the Becoming Engaged. It's an intro to ACT. And then let me fix some of these things. Okay. So today, what we'll be going over is a brief history of behavioral therapies, and then also kind of going over like the core principle of acceptance and commitment therapy, and specifically what we're changing in ACT. Then I'll go over the three pillars of the hexaflex, and then describe the values in committed action, which is the engage pillar of the hexaflex. And then we'll go over specific engage exercise that I use with clients. And then not only will I break that down on how to use it with clients, but kind of thinking about the multiple ways that you can really be flexible with that exercise. Also, I will kind of throughout this, I will describe how I go about things with clients just to give y'all insight on using ACT with clients. So feel free to use some of these same tactics with your own clients or anything like that. Okay. Now, I do really enjoy this exercise. But before we get started, I actually want to use just 5 minutes. The first 5 minutes, you can go ahead and grab a pen and paper or even use your phone. And I want you to write down anything that shows up internally for yourself. Now, this is an exercise to help us just be present, um, including me. Um, but this will not be shared with anyone. This will not be shared in the chat. This is simply just for you and to allow yourself to be present in the moment. So please feel free to write down what is showing up in the moment. I'll give everyone about 5-ish minutes, and then we can kind of jumpstart the presentation. Okay, now we can come back to the presentation, and let's go get started. So I will, throughout the course of this presentation, I will use the term internal experiences and sometimes also use inner experiences. But I just wanted to give a definition of what that is. It's mainly the subjective and private thoughts, feelings, emotions, and physiological sensations that occur within an individual. Um, I want to go over this just so people don't get lost, but also to know within a lot of acceptance and commitment therapy books and even scholarly writing, you will often see this term. And so this isn't something that I created or even I started using. This is something that I've read and often see and will use. I even use it with clients as well to help them talk about their thoughts, their feelings, their emotions, and even physiological sensations. All right. Now, let's talk about a brief history of behavioral therapy. So there have been over three different waves. And when we kind of say waves, these are just different like eras of behavioral therapy, really. So really you kind of see the first wave of behavioral therapy really start in the mid 1900s. So, that was with specifically behavioral therapy. You had people like Skinner, Pavlov, everything that's behavioral, just sticking behavioral only. And then you kind of had the evolution of that, um, of wanting to include cognition into therapy. So that's where the second wave of behavioral therapy, that's where cognitive therapy was. That's where cognitive behavioral therapy is. Um, and so you really see the second wave of behavioral therapy with between like the 1980s to 2000s. And then you get to the third wave of behavioral therapy. And that's where we will be talking specifically with acceptance commitment therapy. But people also like to mention the third wave therapies include mindfulness-based cognitive therapy, DBT, and then of course, as I mentioned, acceptance commitment therapy. Now, I wanted to mention this third wave behavioral therapy because a major difference between this and the other second and even first wave of behavioral therapy is that within acceptance and commitment therapy, it considers the contextual nature of thoughts, feelings, emotions, and physiological sensations. And it works to alter the context while living a valued life. So, in other words, ACT changes relationships to internal experiences rather than changing the internal experience themselves. So I just kind of want to walk through a example of this. So even throughout while making this presentation, I often had the thought of you will embarrass yourself during this presentation. But when that thought would come up, I would often be annoyed, I would be angry, and even disgusted. So, of course, if you kind of think about it, it makes sense that my reaction to this thought, if this is my if this is my emotional reaction to this thought, that I would try to fight this thought, or I would try to avoid it. I would try to talk back to it. But within ACT, what we want to do is change that relationship so that it's not so, what's the word I'm looking for? Um, it's not a negative relationship. It's one where we can be neutral. We can have a neutral stance towards this thought. That way we can hold it lightly. We can even listen to it. And changing the relationship with internal experiences is really the core principle of ACT. I think it's important just to remember this because, at least for me, once I understood the main definition and the main principle at hand for ACT, I could kind of like go into sessions with clients and not be so focused and hooked on specific processes, which we'll go over next, but really see if we can kind of discuss the definition of this specific principle with my client. And sometimes it's a starting point with the client. It's like, are you willing to change your relationship with your internal experiences? Um, but again, changing our relationship with our internal experiences is the core principle of ACT. And we go about doing this by working on the client's psychological flexibility because we want them to be more flexible. And the way we do this is using these 6 processes. And the cool thing about this is we can break down these 6 processes into 3 pillars. And so these 3 pillars include open, aware, and engaged. But today, we will primarily just work and talk about the engaged pillar. So the engaged pillar includes values and committed action. Now let's go over what values are. Now, values are principles that help you guide your life. I really like to think about values as a physical path. It's a path that we create. It's something that we enjoy. And the cool thing about it is that if we don't like it, we can change it. And also, values are a thing that you participate regardless if people are looking. And so I think one thing I really like to kind of like talk about with clients is really talking about how values is a path that we create and how there's flexibility in kind of deciding if we want to stay on this path or not. And another way kind of thinking about values is thinking about meaning in life. It's like we can give meaning to our own lives. We don't have to wait on meaning to come to us. So, values can really range from a number of different things. They can be personal growth, they can include health, they can be leisure, they can be spirituality, they can be education, they can be art, food, relationships with others. These are just vague, I guess, categories of, different values people may hold. And even I hold some of these values as well. But I also want to discuss what values are not. So, values are not goals. Now, goals can help us participate in our values, and that can be a way to make sure that we're actively participating in our values, but they're not values in themselves. That's mainly because goals are a destination, while values are not. The same thing goes with feelings, how values are not feelings. And sure, we can really enjoy being happy, but when you start to value it, that's where you really set yourself up for failure. And that's mainly because if we're kind of thinking about how we engage with our emotions, our thoughts, and even our feelings, we can often notice that there's not a lot of control in terms of what shows up. And we're in kind of like the philosophy of ACT is being flexible with what shows up. So if we're trying to say that we value being happy, we can't promise that we will always be happy. But we can promise being a father if that's what you value. That's something you can actively participate in. If you value cooking for your family, that's something you can actively participate regardless of how you feel in the moment. And so that's where I like to really guide my clients and really kind of telling them that's why values is more of a path and not so much goals or even affiliate. Another cool thing with values is that they can be very prominent in our lives, and we can make them as prominent as we want to in our lives. And a lot of times we can do that because we have the resources, we have time, our environment is fit and set up for us to participate in this value. But sometimes over the course of your life, things change, whether it's your environment, whether it's you as a person, whether it's your resources change. And sometimes that value has to take a backseat within your life. but it doesn't mean we have to dismiss this value. And the same thing can be said for the inverse, where we can have a very strong value, and over the course of our life, this value can become more prominent. I like to kind of describe or give an example of this flexibility and kind of moving our values to the front of the line or the back when it comes to, at least for me, I very much value being a father. I don't have kids, but it's something I'm very excited about. Um, and so I can't really participate in my everyday life. But I do have a cat, and I do like to joke about me being a father to my cat. But I find different ways of showing my cat affection. I make sure, I kind of make sure she's well fed, her litter's clean, things like that. But, if my cat wants to be loved by me scratching her on her lower left jaw, I make sure that's something that I do. That way I can show love to my cat. And that's a way I can be a father in the moment. But of course, in this moment in my life, this value kind of takes a backseat. And I would hope in the future when I do have kids that this will be very, very prominent. But all that to say, I really want to sum up by saying that values come with flexibility. You can be flexible with your values. And I think it's important to note that to clients as well. Like just because, you don't have the kitchen to do baking in the moment in your life right now, it doesn't mean you have to discard that value in your life. There are other ways of kind of going about it, whether that's, finding ways of like cooking with friends or even like watching YouTube videos or, kind of other ways, kind of thinking outside the box and being flexible with your values. Um, I think another thing to kind of think about is, as I mentioned, um, as a as a person, you will change over time due to life events, perception of your past and present, your environment, whatever it may be. So I think it's very important to highlight to your clients that not only should your values be flexible, but you should also be flexible to your values. So if something is not fitting within your life anymore, then I think it's okay to kind of discard that value. Um, yes. Now we're kind of thinking about the engaged pillar. Let's kind of briefly, um, we have two items. We have the values and then we have the committed action. Now, with committed action, the thing about values is we have to actively participate in those values. We have to make the intention and the active decision to say that I'm going to participate in my value. And so I think this is another really important piece to values because, a lot of times we can talk with our clients all about values all day long. We can help them explore their values. Um, we can do a variety of different things regarding values with our clients. But the thing is, if we don't have action, if we don't have a behavioral change that includes engaging with the values, then that's kind of like where we've missed the point in terms of like really committed to meaning in your client's life. So, yeah, I always like to highlight this because sometimes this committed action can kind of take the back seat um, with your clients and even thinking about acting itself. But it's important and necessary to highlight that this is something that requires intention. It requires behavioral change. Um, because often clients are coming to therapy because their quality of life is not great. And I'm willing to bet if their quality of life is not great, they're not actively participating in their values. So this is where our skills as a therapist come in, and we use our intervention skills to say, okay, let's have a behavioral change. Okay, now I want to go over a very specific exercise that really uses both parts of the engage pillar. So it includes the values and includes the committed action. This is something I just started doing once I started seeing clients, specifically college students. I really learned that not a lot of college students have values, and there's nothing wrong with that. Um, but exploring that could be somewhat difficult because a lot of times they just want to not be anxious or not be depressed so that they can spend time with their friends. And of course, even within that, you can see their values like being social, friends. Like you can kind of pick up on those things. But a lot of times I just wanted to get straight to the point with the client. I didn't want to go down that path of explaining values, things like that, because it would have had to been with every single client. So I kind of came up with this idea of asking my clients the specific question of who do you want to be in 5 years? And so I really go into depth in terms of I'm asking this of like what type of person do they want to be? I make sure I tell them I'm not talking about your job, I'm not talking about your finances. I'm really talking about like the person that they want to be in 5 years. Or I'll say, how would a friend describe you in 5 years? This really this really gets to the point and really drums up emotion for them because it creates a vision for them of who they want to be. And even within that vision of who they want to be, embedded in that, there are values. Um, and then from there, after I asked that question, after we kind of like discussed it, we've gone back and forth with it. They have a clear idea of who they want to be in 5 years. I ask, how far are you from being that person? And this really is just to help the client recognize how much work is required to get to that place, to be that person. And really, that's just creating insight, even awareness. Um, and then after we kind of gone through that stage, I asked them what's getting in the way of becoming that person. Um, this is not only is this helpful for you as the therapist, but also your client. Um, and how it's helpful for you as a therapist is sometimes they will talk about not only internal barriers, and you would imagine that's really where they bring up their anxiety or their depressions getting in the way of being that person that they want to be. But sometimes it brings up external factors, external barriers that may be that were never discussed in therapy. Um, and sometimes that may even alter the direction you take therapy in some cases. Um, I know there's been a few times where I've done this with my clients of color or clients that are not from this country, and they talk about how it's like a culture shock living here. And so I'm like, oh, not only is there anxiety showing up in terms of like being social, but they don't feel at home. They're there's things that are missing inside of them. And so then that's where we kind of like do additional things for therapy. And sometimes they even talk about finances. Um, or yeah, I think finances have been a common one. Um, but yeah, it gives them insight of like what's coming up for them, what's getting in the way, but then also helps you as a therapist to say, oh, like, I wasn't thinking about this. This is something we can work in. We can go in this direction. We can work on that. And then the fourth question is pretty much the other kind of like uh, second half of the engage pillar, which is just as important. It's asking the client, what will it take to become that person? And so that's where you get a lot of like motivation from the client and um, And then also, like, what are the specific actions? What are the specific things that the client has to do to become that person? So, um, yeah, and I really like this question because it gets at the committed action. It's very direct. And it's kind of embedded in this exercise, and it kind of flows of saying like, okay, we have a goal. What's getting in the way? What will it take to get there? Um, there's also buy-in into the therapy at that moment of saying like, yeah, like the client can be like, okay, this is what I have to do. This is how far I am at. This is what we'll be working on. And so there can be a lot of buy-in from the client at that point. Um, but I highlighted the first question and the fourth question because those are the specific questions that really get at values with the first question, and then committed action on the fourth question. Um, and the really cool thing about this is I've used this in a variety of different settings. So I've used this in settings where sessions are 25 minutes. And even with that, clients are limited to about 6 to 9 sessions. And I've done this even with long-term therapy clients. So the cool thing is about you can really shrink this into as fast as about 5 minutes, just talking to them and saying, who do you want to be? How far are you from being that person? What's getting in the way of becoming that person? What will it take to be that person? To even stretching it out to a whole session. Often, what I'll do is I will give my clients the first question of who do you want to be in 5 years as a homework. And then we kind of do essentially we do questions 2, 3, and 4, and then review question one the next session. So it could take up the entire session. The other cool thing about this is sometimes there has been moments where I deviate at at any given question if the client is getting stuck, because that's a place to explore with the client. Um, it's like a cool, I kind of, now that I see it, it's kind of like a cool highway where like if a client gets stuck at any question, you can really just get off the highway and just spend time on that one question for however long it takes. The other cool thing about this is I will visually draw this out with clients as well. And the way I do this is it looks exactly like this. So I will draw a door, I'll draw them, I'll just draw a stick figure, honestly, and then I'll draw a circle. And so with the door specifically, that's where I ask, who do they want to be in 5 years? And I wrote down an example. A very common one with clients that I've had is like, I want to be a social person. Now, obviously, their response is probably more nuanced and actually a lot larger. So, you can even list them out on the door as you're drawing them, or you could help them summarize what the overall idea of who they want to be in 5 years. But I put on the door because I always explain everyone is trying to get somewhere. And I explain how, yeah, you're trying to get to that door. And then of course I ask them, how far are you away from being that person? Sometimes I'll even create distance between the stick figure and the door to help them visually see that maybe they are very far, maybe they're actually really close, but not all the time. And then, of course, I'll ask them what's getting in the way of becoming that person. And that's where the circle in the middle really, really work. And that's where I just write them out. So a lot of times clients will say their anxiety, their depression, but sometimes other emotions show up like anger. And it's like, okay, this client came in for anxiety, but it's talking about anger right now. And so I can ask the clients like, oh, why is anger showing up right now? Then that can be another emotion that you explore with them. And of course, as I mentioned, external barriers sometimes show up here as well. Um, But as you can see, as we're even going through this exercise, you can really see how you can deviate and spend time and just marinate in this idea at any one question. And then the cool thing about this is once we've drawn it out and we step back, sometimes I'll ask them about their reaction just to visually seeing it, or I'll kind of go in this mode of kind of looking for buy-in to therapy. And I tell them, okay, so could the anger and the anxiety, could that be the place that we work? And that's what I tell them. Um, can that be something that we work on together so that you can become a social person? So I'm always kind of like, yeah, thinking about buy-in, thinking about um, like motivation to therapy. A lot of times clients are just like, yeah, absolutely. But it's very possible that I would imagine you get a client that is like, I don't know if I want to do this. So then that's like, okay, let's explore that. But again, that's why I really, really enjoy this exercise um, with clients and specifically for the engaged pillar. The other cool thing is I often, the setting I'm at right now, I have whiteboards in pretty much all the therapy rooms, so I can draw this for clients. Sometimes I'll have them write in like their anger, their anxiety, or I have them write on what's on the door. I've also done it where I do it on a piece of paper and I walk through this exercise with them, and that way they have something to take with them, so they can just visually see it. Um, but yeah, that's why I really, really enjoy this exercise. Um, and again, these are the four questions that I really go over with them. I'm trying to think of anything else. Um, I think this is another good example of how, because kind of thinking about the vocabulary with clients, I think early on for me, I was very conflicted about using specific lingo with clients, thinking about, do I have to say the word values with clients? Do I have to say the word committed action? But the cool thing is, you do not. You can, if this is a good example of just using language that is, I guess, very conversational and kind of highlight, you're still picking up values, you're still kind of thinking about committed action. Yeah, but there's no pressure to use the lingo that therapists, that researchers talk about when they're talking about ACT. I think that's another thing to really highlight is that, yeah, you can use your own lingo, you can use your client's lingo. Really, it's all honestly all about being flexible in the moment. Um, but um, I'm trying to think. I know I had one other thing to mention about this. It's not coming to mind. But again, this is my favorite exercise I do with clients. Um, this really gets the ball rolling with values and committed action. Um, and again, it's very flexible in terms of like what setting you use it in, also how you go about using it, and even time length in terms of using it, whether it's a quick, brief 5 minutes or you spend 2 sessions on questions 1 and 4, or even 2, 3. Yeah, that's a cool thing about this exercise is there's there's many places to explore with the client, kind of going back and forth. Um, but that's all I have for today. I want to thank everyone for showing up